Thank you, Chief Thomas. Once again, I'm Ryan Meili. I work at a community health center called the Westside Community Clinic. Some of my colleagues from there are here tonight. And I thought I would just start off with a few words about what's happening with HIV in Saskatchewan from my point of view. And my vantage point is usually walking from work to clinic and thinking about what's happening in the neighborhood around me. And one of the people that often comes to mind when I think about HIV in my neighborhood on the west side of Saskatoon is somebody that I call her Crystal. Not her real name, but one of the patients that on occasion comes to Westside. And very often when I'm walking to work, I run into Crystal and she makes my day and she breaks my heart. She makes my day because she always has a big grin and a big wave, and when she does come to clinic, she is hilarious. She makes fun of me, as so many of my patients do. And you know, she's just a lovely person. But she also breaks my heart because I'm seeing her on my walk to work on a corner and not in the clinic. And I know that she needs to be in the clinic because when she does show up, it's with a pneumonia or another opportunistic infection because she has HIV. And her CD4 count at one point was as low as 6. That's not an uncommon story where we work. But I think it's a really interesting story because if I told that story 4 years ago, the ending would be different. It would have been a spiral into more and more infections and be one of the many patients that young people that we've watched die. Some very quickly and some very slowly and painfully. But she's different. She, in the last few months, she got connected through Housing First to stable housing and actually has a regular place to stay. And after that, even though I think a couple of my colleagues in the back had tried to start her on methadone a couple of times at least, and it didn't work out. Now she's on methadone and she's taking it regularly. And she's taking her antiretrovirals regularly. So she's not getting sick as much. And in fact, she's doing a lot better. And I actually see her more at the clinic than I do on my walk to work. So that's a hopeful story that I think is not unique. It's not singular. And it's exciting to me because when we look back at what was happening 5 years ago, in terms of the incidence of new cases of HIV, tripled the national average, and very high rates of new cases, also very high rates of bad outcomes. People progressing very quickly from HIV to AIDS, lots of hospitalizations and lots of early deaths from AIDS-defining illnesses. And then we've seen change. Over the last few years, we have seen that incidence decrease, come down considerably. And we've also seen real change. In particular, I'm aware of what's happening in Westside, where we have 400 patients who are HIV positive, are in some, and we've gone from a small percentage being on treatment and having their viral load undetectable to now over 50% have their HIV under good control, which, considering the challenges, the social, financial, and historical challenges that are faced by the people who live in that neighborhood, that's actually an extremely good outcome. So we're very happy about that, and I think there's 3 things that have made a difference. There's lots of things that have made a difference, but 3 that I emphasize, and they're really connected to the leadership of some of the people in this room. Leadership of the people who were starting antiretrovirals when that was new and really hard to do. Pioneers like Kurt Williams and others in the ID department, folks like Stephen Hellier, who, when people thought that was crazy, was a family doctor prescribing antiretrovirals. Having those medications available and being prescribed and taking some risks at times, prescribing to people we weren't sure we were going to be able to manage it. And then methadone. Having addiction support like methadone has made an enormous difference in terms of the ability to connect people to care and connect them to getting their addictions under control and subsequently their HIV. And then the last is meeting people where they are. the outreach and case management work that has been done has been incredible, and I wish our outreach workers were here with us today, because they do an amazing work going out into the community, finding people, getting them to appointments, just driving them around, spending time with them, and that makes all the difference in whether they can actually connect to healthcare or not. So there's progress there. There's still a great deal to do. Even though our incidence has dropped, we still have twice the national average of new cases in this province. And we still have way too many people in the hospital, way too many people who aren't on treatment, and bad outcomes as a result. And as a result, the Ministry of Health's own estimates were spending $40 million plus a year on acute care. And alongside those costs to budget are also the major costs to our families and our friends and our communities. So we have more to do. And what I'm hoping we'll hear about tonight from our three guest speakers, we have Dr. William Montana, who is a world-renowned expert in HIV and going to talk about treatment as prevention. We have Margaret Buttress from All Nations Hope, who is a tireless activist. You get tired sometimes, or you must, because you do so much with All Nations Hope and working on the Indigenous strategy for HIV in Saskatchewan. And then Dr. Mona Lutfi will share her experience from Toronto and more recently from working in Northern Saskatchewan. So without any further ado, I'll invite Dr. Montana to the stage.